Hi everyone. I'm Rachel, and I'm a public health inspector on the infectious disease team. And I am excited to introduce our next speakers. So we have a presentation by members of the Vaccine Preventable Disease team. Susan Bruce, who is a public health nurse on the Vaccine Preventable Disease team, and she'll discuss influenza vaccine. She will be accompanied by Raquel Vertusio, who is a fourth-year nursing student on the Vaccine Preventable Disease team, and she will be giving general vaccine reminders. Following Raquel, we have the Vaccine Preventable Disease Program Assistant, Amy Reisner, and she will discuss COVID vaccines. So just like before, just keep questions until the end, but you can ask at any time in the chat, and we'll discuss them at the end of the presentation. So take it away, Suzanne.
Thank you. Hello, everybody. So my name is Raquel. I'm actually going to give a head start for this presentation. So while we're talking about vaccine updates, I'm just going to give my little presentation here about routine vaccinations. So I'll just be talking about some of the publicly funded vaccinations, ranging from different age populations. So I'll first start off with the shingles, moving on to the pneumococcal, and then the tetanus, diphtheria, and pertussis vaccine. And then later on in the presentation, Susan will speak to flu, as mentioned previously, and Amy will speak to the COVID-19 vaccination. So starting off for one of the publicly funded vaccinations, we'll be going into the shingles vaccination. So shingles is a painful rash that appears on one side of the body. And the same virus that causes chickenpox actually lays dormant in the body and can manifest as shingles later on in life. So as mentioned on the screen, it protects against shingles and post-therapeutic neuralgia. The Shingrix vaccine is available to individuals 65 years to 70 years of age, and these individuals are publicly funded for 2 doses. The second dose, which is available 2 to 6 months after the first dose. A frequently asked question many people have is if they've had shingles before, how long can they wait before getting Shingrix? And the answer is 1 year. Moving on to the next vaccination is the pneumococcal vaccination. And pneumococcal infections are caused by pneumococcus, which outcomes can range from ear and sinus infection to pneumonia and bloodstream infections. So one of the vaccines to prevent against that is Prevnar 13, which is the one listed on the left. And 1 dose is publicly funded for high-risk individuals over 50 years of age. So high-risk criteria may depend on the individual. So it's recommended for them to contact their healthcare provider to determine their eligibility. Another vaccine that is available for the pneumococcal vaccination is Pneumovax 23, and 1 dose is publicly funded for individuals 65 years of age and older. And high-risk individuals under 65 may be eligible depending on high-risk criteria, which, if unsure, please contact your healthcare provider to determine your eligibility. Moving on to booster dose. So Pneumovax 23 has a booster dose available 5 years later based on the eligibility criteria listed on the screen. Again, if you aren't sure, please contact your healthcare provider and have the discussion about eligibility. It is important to note here that 1 dose of Pneumovax 23 should be given more than 8 weeks after the last dose of Prevnar 13. Or, if Pneumovax was given first, Prevnar 13 should be given more than 1 year after. Moving on to the last little tidbit that I have, tetanus, diphtheria, and pertussis. So tetanus is causes a painful stiffening of the muscles that can enter the body via entering open wounds, so like stepping on a rusty needle or nail. Diphtheria can lead to breathing issues, heart failure, paralysis, or death, and can be spread person to person. And pertussis is also known as whooping cough, which also can be spread person to person and can result in pneumonia, convulsions, brain damage, and death. So one adult booster of Tdap has been publicly funded since 2014, and then once that individual receives Tdap, all other 10-year boosters will be the TD absorbed. It is also important to note here that individuals lacking adequate documentation of immunization should be considered unimmunized. And so just contact your healthcare provider if you have any other questions regarding that. So a lot of another frequently asked questions, if they need the vaccinations, they can be found and administered at your local healthcare provider office or via Southwestern Public Health clinics, in which you can book online. And so sometimes it's hard navigating the website. So I've made this slide here to make it easy to identify when booking an appointment with Southwestern Public Health. So if you go to southwesternpublichealth.ca, it'll bring you to their homepage, in which you can click the first left button right there. I've marked it with the arrow under classes, clinics, and services. You click it down, a drop-down menu will pop down, and you can choose immunization clinic. If you scroll down, you can choose this big box that says book appointment now. It'll take you to the link I provided in step 3, in which you can fill out all the relevant information, such as places you're going to get the vaccine, and then choosing what kind of vaccine you want to get. Thank you guys for my little tidbit.
Great. And this is Susan, so I'm here to talk about influenza vaccine for 2022. So the numbers of seniors in Ontario is rapidly growing, and they are a vulnerable population, vulnerable to serious complications related to flu. So vaccination is their best defense. Congregate settings with people who are at risk for transmitting the virus, and they have people who are at risk of disease. So it's important for those that live and work in congregate settings to be immunized. Each year, respiratory illnesses like the flu cause countless outbreaks in congregate settings, resulting in resident and staff illness, staffing challenges, missed work, and visitor impacts. So immunizations have started now for the priority population. So they're high-risk individuals, those that are high risk for hospitalization due to flu, and the healthcare providers that take care of them. Vaccine is currently available at most participating pharmacies. It started to come to pharmacies last week, as well as your healthcare providers. In November 1st, then the general population is able to get their flu shot. So currently, who is high risk that can be immunized in October is anyone over the age of 65, people with underlying health conditions, so cardiac and pulmonary disorders, diabetes, metabolic diseases, renal disease, cancer, those taking medications that suppress the immune system, Indigenous peoples, healthcare workers, and pregnant women. So we didn't put on there just based on our clientele today and those that are participating in this, but under 4 years of age are also considered high risk. So there's different vaccines that are available. I'm not going to go into it a whole lot, but just so you're aware, if a client goes to a healthcare provider or a pharmacy or a Southwestern Public Health clinic, if they're under the age of 2, that there's different products that we offer. So there's 3 quadrivalent products for those under 65, and then there's 2 senior products, which are the quadrivalent high dose and the TIV adjuvanted. So the quadrivalent, so that has 2A and 2B strains. We have been using that for our under 65 population for a few years now. So anyone 6 months and older is eligible for that vaccine. And then 65 and older, there is a quadrivalent product that has more antigen in it. So it's called high dose Fluzone, and that creates a better immune response in the senior population. Also for the seniors 65 and older, there's a trivalent product called Fluad. It protects against 2As and 1B, and then it has an adjuvant in it, which helps create a better immune response for the seniors. So for the flu vaccine, young children and those that are high risk are currently eligible at the primary care, so a healthcare provider's office. Pharmacies can help those 2 and over, and public health, we're having clinics here currently that you book online the same way that Raquel mentioned for those 2 and under and their families and their guardians. High-risk populations can go currently to pharmacies, healthcare providers, and as of November 1st, the general population is eligible. In addition to primary care and pharmacies, if someone has a COVID vaccine clinic appointment booked, then they are able to get their flu vaccine as well. Just note that we are only carrying the under 65 quadrivalent product at our COVID clinic. So anyone who needs a senior vaccine will need to go to a pharmacy or healthcare provider. So for in-house flu vaccinations for group homes, you can contact the local pharmacy and see if they're willing to come to your facility to immunize. Just a reminder that they must be from Southwestern Public Health. Flu vaccine cannot cross county borders. So if you're St. Thomas home, you cannot get someone from Middlesex, a pharmacy from Middlesex, to come in to give your flu vaccinations. You can contact your nurse practitioner or MD and see if they're willing to come in. There is a few that might do that. And for Oxford County only, you can contact the paramedic services. The paramedic's name is Sue White, at that contact information there, and make arrangements with her to come do your flu vaccines if you wish.
Sorry, it's Amy here, and I just spoke to Sue late on Friday, and I have an updated phone number for her.
Okay.
So sorry, I changed it in my slide related to COVID vaccines, but it got missed in the flu section. So
we can update it and send it to Joanne. See
Yeah.
if you wait before you send it out, Joanne.
Yeah.
Okay, perfect.
Okay, so as mentioned, I'm Amy, and I'll be speaking to you about COVID-19 vaccine updates. So currently, in Ontario, the vaccine eligibility is a primary series is considered 2 doses of COVID-19 vaccine and a 3rd dose if an individual is immunocompromised. And then for booster doses, that's considered dose 3 and dose 4, and residents are now eligible for a bivalent dose. And this vaccine is available for all individuals who do not have any contraindications to receive the vaccine. And just as a note, it is recommended that all moderately to severe immunocompromised individuals receive a 3-dose primary series. So the timing for the intervals for the vaccinations would be for anyone who is healthy. Actually, it's the same for both, for a healthy individual and an immunocompromised individual. A 2nd dose is given 56 days after the 1st dose, and the minimum interval is the 2nd dose given 28 days after the 1st dose. And for booster doses, the recommended interval is 6 months or 168 days after the last dose. And the minimum interval of time is 3 months or 84 days after the last dose. So the vaccine products we have available now, we have currently Pfizer and Moderna, the monovalent product, which is available for people who have not completed a primary series. And on hand, we just in on Friday, hot off the presses, we have received our Pfizer bivalent vaccine, and we also have Moderna bivalent vaccine. We are able to get from the province the products of Janssen and Novavax for those who, but that's on special request only. It's not something that we routinely carry. For people who have allergies, we can request the other types of vaccine if needed. And also, again, newly as of today, all individuals in Ontario 12 years and older are recommended to receive the new bivalent Omicron vaccine, and that remains the same for long-term care homes, retirement homes, elder care lodges, and those living in other congregate settings, just that those individuals would be recommended to have a bivalent dose, and that's regardless of the number of previous doses they've received. So how to obtain vaccine for your residents. They can book an appointment, or you can help them book an appointment online for one of our mass IMS clinics. Pharmacies have the vaccine. Most pharmacies have the vaccine available. And if we had enough interest, we would be able to organize the GoVax bus, which, they make their way around the province, and the contact information is there for our admin assistant, Jessie Gordon, who could help facilitate this. And then this is the updated phone number I was mentioning for Sue White. So this is for Oxford County. She's willing to assist with congregate setting immunizations. So just give Sue a call and she could help do some in-house vaccinations for you. Some of the frequently asked questions we get, as Susan was talking about, it's now flu season. So people ask us all the time, can I have both of these vaccines at the same time? The answer is yes, you can. So anyone for 5 years of age and older, it's safe to get any other vaccine in conjunction with the COVID-19 vaccines. And then the ideal time between the boosters. So it's always recommended that the longer intervals between doses results in a more robust and durable immune response. But you could follow the Ministry of Health guidelines based on the risk of the client. And then another frequently asked question that we get is how long should an individual wait for a booster after having COVID disease? So that depends whether an individual has completed a series of COVID-19 vaccines. If they have and they're healthy, a minimum of 3 months or 84 days after symptom onset. However, 6 months or 168-day interval may provide a better immune response regardless of the product given based on clinical decision. And then for immunocompromised individuals, if infection prior to completion of an initiation of primary vaccination series, they would receive the vaccine 2 months or 56 days after, or if immunocompromised, they would receive the vaccine 1 to 2 months or 28 to 56 days after symptom onset. There is a list of our references, which we will provide to Joanne, who will provide to everyone, and then questions.
So one of the questions was, does Southwestern Public Health Clinics have both COVID bivalent products available? So yes, they do. That started today.
Yep.
And do pharmacies have the bivalent vaccine available yet?
So some pharmacies, I was speaking with Lisa Silverthorne at Shoppers Drug Mart. I was actually over there this morning, so she has it. So Shoppers, I know, has started to receive it. Rexall, I spoke with Ronnie at Rexall last week, and he expects that his Pfizer bivalent will be arriving sometime this week. So those are definitely our two main pharmacies that carry it. Zayres has it as well, but I don't think Zayres has it in yet either. But within the next week or so, any participating pharmacy should have it in stock as well.
Thank you.
Thank you.
Thank you.
There was one more question added. Any pharmacies in the Elgin region that you're aware of that have the bivalent vaccine?
So I'm not great at speaking to the availability of pharmacies in Elgin because my home is Oxford, but
Does anybody know Elgin region?
So I'd like to think that any Shoppers, I feel Shoppers was pushing it all out at the same time. And then I know Urix is another big one that they've done the bulk of Elgin vaccinations. So I think it's probably pretty safe to say that they would have it too.
Or they can order it now that it's available. They could order it whenever they want to order it. So if you have a specific one in mind, you can certainly call and ask.
Yeah, good idea.